Good day, everyone. I am Jen Reyes, Executive Director of the Masayang Pamilya Organization, Inc., and also the project lead of parenting within the social welfare system in the Philippines. So good day. I'm here to share with you the scaling um, project or aim of Masayang Pamilya program within the local and national level. So just to give you a brief background about our organization. So our mission is to empower parents and caregivers to strengthen positive relationships with children through evidence-based, collaborative, and creative ways. So our vision is that we are a trusted partner in pioneering and developing evidence-based parenting programs, specifically in reaching children in every context. Okay? So what is our aim or dream when it comes to scaling MaPa and the local and national levels? So we have here policy supported pathways to scale. Uh, First, in the national level, wherein we want to integrate MaPa in national conditional transfer or CCT here in the Philippines. So it's called the Pantawid, a Pamilyang Pilipino program, wherein within that CCT, there's a condition or a program called Family Development Sessions or FDS, wherein it's a condition that every um, beneficiary should attend. So it's conducted every month, and it's a session that's everything about parenting and family development. It also includes health, education, and financial literacy, okay, for the beneficiaries. So right now, there's around 4 million PCT or Pantawid beneficiaries here in the Philippines. The other pathway that we are hoping for is the integration of the MaPa program in city and municipal local government units or LGU through their social welfare and development offices. Okay, so in this way, so for the CCT, it's more of a vertical um, scale, wherein for the LGUs, it's more horizontal. Okay, so right now we are partnering with selected LGUs here in Metro Manila, also in Luzon and in Mindanao Island, and we are testing. Okay, we are testing the MAPA programs, and we are hoping that they'll be institutionalized within their local government unit. Okay? Meaning it will not just be implemented one time, but it will be part of their local constitutions or we call it ordinance here in the Philippines, so that there will be allotted budget and there will be allotted people or staff that could implement the program, the intervention program. Okay? So before I share our success at the national level, I just want to give you a brief background about how we started in integrating the MAPA program within a national program or the conditional cash transfer program in the Philippines. So in 2021 or 2020, yeah, 2021, during the pandemic, that's also the time that everything shifted from in-person to digital platforms. And that became an opportunity for the MAPA program to be integrated in the Electronic Family Development Sessions or EFDS of the Pantawid program, the Philippine CC, just like what I mentioned earlier. And we were able to integrate 6 modules, which were implemented through different modalities. So you had there through Facebook, through home visits, through small group neighborhood discussions, reaching 4 million beneficiaries. Okay, so it happened in September to November 2021 and January to March 2022. So that's the first time that we're able to integrate MAPA in the national program. We're able to train around 5,000 social workers and community service providers who actually provided support to the 4 million beneficiaries. So through a series of webinars, we're able to demonstrate the core MAPA skills through the demonstration of comics, because it's something that we also do when we are delivering the program. We we also incorporated practicing the MAPA skills through online modality. Okay, so basically we're translating the core components of the in-person MAPA program uh, to the online platform. Okay, so that happened in 2021 to 2022. And then after that, in 2023, the family development sessions uh, underwent a transformation, or like they revamped it. Okay, and they called it now the FBS 7-year transformative learning path, or 7YTLD. And so it's a 7-year program. And in year 1 and 2, um, MAPA parenting skills, at least 4 MAPA parenting skills are actually integrated, okay, in the family development session. Okay, so as you can see, in year 1, there are 2 MAPA skills, specifically giving positive attention to your child through one-on-one time and praise, and household rules and routines to support children's positive behavior. They are integrated in year 1 of 7YTL. So right now it's already in year 2, and there are 2 other MAPA programs that are being implemented and delivered uh, to the 4 million beneficiaries, for these beneficiaries. Okay, so for us, this is already a highlight, or a success. However, okay, just last year, um, there's also another opportunity when DSWD Secretary commissioned Dr. Lian Pena Alambay, who is the chair of the Board of Trustees of the Masayang Pamilya Organization, Inc. She's commissioned to review and assess the CCT Family Development Session frameworks, goals, and sessions to know the good practices, the challenges, and also the gaps. So reviewing and assessing would be used to enhance the framework, the content and curriculum and system of delivery of FBS 7YTL. So this actually happened since October 2024 until now. And then we also recently received another phase of the development, wherein again Dr. Lian Pena Alambay is commissioned to enhance the modules. So with the help of the MAPA organization, we'll be able to integrate and also use the lens of positive parenting to address other societal issues, family societal issues, such as education of children, child maltreatment, um, also health, and education for early childhood learning, okay, to be part of the family development sessions, okay, the modules, okay. So for us, working with the conditional cash transfer, or the Pantawid program here in the Philippines, we have some key learnings, okay. So first, it's having champions within the government offices, or within um, the government system when it comes to positive parenting. So meaning there should be people within the national offices, okay, that they actually believe in parenting, that uh, they also believe that the MAPA program is key in making sure that there will be behavior change when it comes to the Filipino families. In this case, with the beneficiaries of the traditional cash transfer. Um, Next is how we're able to truly understand and navigate the systems and norms when it comes to national, local, and community levels. It's very important to be open on how we can work with them and know the different constraints and uh, different ways of working with them. Okay, so there's really this desire to persist and maintain relationships. Okay. The third one is openness to adapt to different circumstances, specifically if you are working with other stakeholders and programs who are partnering also with the government. The next one is the need for ongoing research, monitoring, and evaluation. So it's very important to have continuous evaluation and gathering of evidence that the program is still working, even though it's implemented in different contexts. Okay, so that's our highlight and learning in the national level. So just like what I mentioned earlier, aside from the vertical, we're also doing the horizontal scaling of the MaPa program. So this time it's with the local government units. And right now we are working with Valenzuela City, which is the first pathfinding city in the world um, to end violence against children. So we're really fortunate that we're able to work with them. We're also currently working with Makati City, which is um, one of the most progressive uh, LGUs here in the Philippines. Okay, so we're implementing and testing the MaPa programs within the LGU through their um, City Social Welfare and Development Office. And our goal is that these MaPa programs, will be institutionalized within their local government unit. So what does it mean? So institutionalization means it's going to be a law within their unit, within their governance. Okay, so we hope that once it's institutionalized, there will be allotted budget, okay, for them to continuously implement the MAPA program. There will be staff, okay, within the LGU that their role will be to implement the MAPA program. So there will be sustainability of the program within the LGU. Okay. And aside from that, we're also hoping that at least these two local government units will be model cities wherein we can show to the other cities and municipalities in the Philippines how we actually implemented what is the approach that we use in these two cities that they can actually adapt and also do in their own cities and municipalities. Okay, meaning how they can implement MAPA and how they can also institutionalize MAPA within their own cities or municipalities. So right now, those are our dream, okay, when it comes to scaling MAPA. So in a national level and in a local level. So why do we have these two approaches? In the last few years, we've learned that we need to diversify. Okay, so initially we're only focusing on the national level, and then realize whenever there's a turnover, whenever there's a change in the priorities of the administration, um, we we were stuck, or we had to pause again and we need to wait for champions, okay, to work with us. And then we realized that, there are also other contexts wherein a parenting program is needed. So aside from national, we also need to work with the local government units. So not just with the national, but also with the local government unit. So that's something that we also learned and one of our highlights as we were trying to figure out how we can scale MAPA program. So we're able to reach Filipino families, not just with the national programs, but also with the local government. That'll be all for me. Thank you very much.